friends. I am Dr. Shivakumar, Senior Consultant Neurologist from Sakra World Hospital, Bangalore. I would like to talk to you a little bit about neuropathy. So, what is neuropathy? Neuropathy is nothing but a disease which involves the nerves which are outside the brain and the spinal cord. So, these nerves are usually called as peripheral nerves, which supply our limbs, trunk, abdomen, and lower limbs. So, what are the functions of these nerves? These nerves basically function in three ways. One is called a sensory function, where they carry the sensory information from our parts of the body to the spinal cord and the brain. Second, they control certain autonomic functions which are in the chest, abdomen, and other organs, including the skin. Third, they control our motor movement. So, what are the common symptoms of peripheral neuropathy, or also called as neuropathy? The common symptoms are sensory in the form of tingling, numbness, burning, paresthesias, and loss of sensation. You can have motor problems like weakness, or you can have problems like wasting of the muscle because of lack of innervation to the muscle. The autonomic symptoms what someone can face is they can have variation in their heart rate, fluctuating blood pressure, which can lead to giddiness, syncope, fall, a loss of consciousness, excessive sweating or dryness of skin, problems with genital functions like erectile dysfunction, and they can have problems with GI tract in the form of indigestion, bloating sensation. So many other symptoms can happen because of this. So, what are the common causes of neuropathy? What we see in our clinical practice? The commonest thing what we see is related to nutritional problems, that is, due to deficiency of vitamins and certain essential minerals. Next common what we see in a clinical practice is related to the most common metabolic disease syndrome called as diabetes. You know, diabetes is very common in India. So uncontrolled and poorly controlled diabetes can cause peripheral neuropathy. Other causes are toxins like alcohol intake, certain genetic diseases, hereditary disorders, inflammatory diseases, and a big group of diseases called as vasculitis, and many other etiologies are there. So, how do you diagnose neuropathy? Neuropathy is diagnosed based on symptoms in the person who presents to you, and we use few tests like nerve conduction study, needle EMG, and autonomic function test. We also do a lot of blood tests to find out the cause of neuropathy, because finding the cause is the most important thing, because we can prevent progression of the disease or relapse of the disease. If you treat the underlying cause, we can even cure or prevent the disease. So identifying the cause is very, very important. Sometimes we might go to an extent where we do a biopsy of the nerve to find out what exactly is happening in the nerve. So, how do you treat neuropathy? Basically, treatment consists of two parts. One is to treat the underlying cause. For example, if someone is having vitamin B12 deficiency, we give them B12 supplements, or control the diabetes if someone is diabetic. The most important thing is reducing the symptoms what they have by using medicines called as neuropathic medications. Some of the medicines what we use in our clinical practice is gabapentin, pregabalin, amitriptyline, nortriptyline, duloxetine, and so on. So, my dear friends, prevention is always better than cure. So, if you have any symptoms of neuropathy, make an early diagnosis by visiting the doctor and find the cause of this and treat it appropriately to prevent this disease becoming more in the future. Thank you very much.